As we continue to battle COVID-19, the hospital beds were full of people who wouldn't get the vaccine. The death toll started to rise across America, and many of the deaths were unvaccinated younger people. Daytona Beach City Manager Derek Fiecher addresses his plans to take the city into the future after the pandemic.
Good morning, good afternoon, good evening, whenever you may be watching this. I am Derek C. Fiecher, and I have the privilege of serving as the City Manager, the Chief Administrative Officer for the world's most famous beach, Daytona Beach, Florida. But we are so much more than just the world's most famous beach. We're 5 colleges and universities, a place that's a destination for family and friends to live, work, play, learn, and raise a family. And I'm honored to serve this community.
Daytona Beach Commissioner Paula Reed addresses the residents on the importance of following the guidelines of staying safe during the pandemic.
I'm here today with Commissioner Paula Reed of Daytona Beach, Florida. Today we're going to talk a little bit about the effects the coronavirus had on Daytona Beach. When the pandemic first struck the country, it also struck Daytona Beach. What would you say you did as a commissioner to help the citizens in Daytona Beach?
Well, I think Daytona is just like any other city in the countries that were also. People lost their jobs, people couldn't pay their mortgages or their rent. And what could we do? And the utility billing is the one thing that we as a city, we do control. And that was greatly appreciated. We've also allowed our citizens to have reduced bills for a number of months now. Just very concerned about them. As a city, we also had masks available for our citizens as well as hand sanitizers. We put little packets together for them to pick up to ensure their safety to the best of our ability. Of course, we were advised by the governor on how to maintain the city time-wise and what have you, and we abided by all of that. We continued to have our meetings so that the city continued to run. We couldn't allow the city to stop. So we even had virtual commission meetings. If you weren't comfortable in coming in, then some of us, but I still came in, but some of us were virtually coming into the meeting so that the city could still run. I think Daytona did the best that they could, and I think our citizens appreciate what we've done for them to help them through. Now, in the beginning, I said I wear several hats. I'm also the president of the Daytona Beach Alumni Chapter of Delta Sigma Theta, and the sorority participated with the Divine Nine, which are the 9 African-American sororities and fraternities, by having food drives every third Thursday. We had food drives for the community, and they would come in groves. People just had a great need. I know with our sorority, we wanted to also keep track of our senior citizens, and we did drive-bys for birthdays and for anniversaries, and just continue to love on them. Our meetings became virtual to ensure the safety, but yet the business of the sorority continued. Then I'm also a member of the Links Incorporated for Daytona Beach, and we did a shield project where we passed out shields, face shields, to all of our local hospitals and nursing centers, just to ensure the safety of our first responders and our nursing and medical staff. So I would say that there was a great reach in our community by a number of people, organizations, and our government to ensure the safety and the welfare of our individuals here.
And where do you see Daytona moving ahead in the future in dealing with the coronavirus?
Well, as you know, the governor has lifted the virus, and things are starting to open back up. People are starting to go out. Some are still wearing masks. We're encouraging you to please get vaccinated. It's very important. And you don't know who is. So if you're in large crowds, I would still advise that you would keep the distance of the 6 feet, perhaps wear your mask, because you don't know if someone has or hasn't been vaccinated, and they could be carrying the actual disease themselves. But as far as Daytona is concerned, we will continue to be the city that we are. Some of our activities have already began to come back. We have lifted up the quarantining of our facilities. Our facilities have opened back up for our youth. As you know, it's now summertime, and the youth need something to do. And so we're starting to come out of this. It's like being, I guess, asleep, and we're waking back up. Our city's waking back up. So we're going to continue to serve our citizens to the best of our ability.
Charles Bryant helped elderly residents register to receive the vaccine at the Midtown Center in Daytona Beach.
I'm here today with Charles Bryant in front of the Rosemary Bryant Center. Tell us a little bit about, what your fraternity did for the coronavirus in Daytona Beach.
Thank you, Duane. My name is Charles Bryant. I'm a retiree from the city of Daytona Beach. I was a redevelopment project manager where I did over 20 years of service for the city of Daytona Beach, and proud member of New Life Church Ministries in Holly Hill, Florida, where I'm a senior deacon. We work with the Daytona Beach Ministerial Alliance in getting people signed up for vaccinations through Volusia County Health Department. This was way back when they had problems getting people to sign up to take the vaccination. We thought it was a great idea to try to get the community engaged. We use different methods of contacting the people in the community, and we were able to get people to sign up through the use of some of the organizations like the Senior Oasis program, and we were able to sign up over 250 people in the community to go and get vaccinated at Midtown Community Center on George Ingram Avenue here in Daytona Beach. And it was a community effort. It paid off dividends, and it's still paying off. A lot of people are still getting vaccinated through programs through the Volusia County Health Department. So it was a community effort, and we appreciate the partnership that we incurred through these different organizations. And we look forward to many more, cooperations with these different organizations.
Dr. Mariel Fuqua teaches African American Studies at Daytona State College.
I am Dr. Muriel Fuqua. I'm a senior professor at Daytona State College. COVID-19 pandemic did bring a dropping of excitement as it relates to ministry. We made sure immediately that since we were on lockdown per se, we made sure that we did things virtually as soon as possible, and want to make sure every household had access. Because many times in a lot of the black families, they don't have access to computers or to the internet. We have virtual Bible study. We called members often to make sure they were okay, to encourage them to do things that were positive. Don't live loosely, wear your mask, and stay in safe environments. We would call them often. Another thing that we did also was this. We made sure that every family had food. My husband, he worked along with a food bank, couple of food banks, local food banks, and we made sure that people had food, that they had everything that they need. They had water, that they had their medications, in particular some of those who were disabled. We made sure that they had everything they needed, and we kept them informed. We made sure they were aware of what the media was saying, make sure they were aware of what the president was saying about this virus.
Kenneth Burns speaks on the Omegas supporting the residents of Daytona Beach during the pandemic.
Good morning. I'm here today with Kenneth Barnes in front of the Rosemary Bryant Center in Daytona Beach, Florida. How you doing?
Hey, good morning. Good morning. Thanks for having me this morning. Good morning again. I'm Kenneth Barnes. I'm a member of the Omicron chapter of the Omega Psi Phi fraternity here in Daytona Beach, Florida. Proud 41-year member, and most recently the immediate past executive director for the fraternity. We're proud of the efforts that our chapter did in collaboration with our church, New Life Ministries, and primarily the men of Kappa Alpha Psi, and some of the other members of the Pan Hale group during the pandemic. Particularly with New Life Ministries, one of the first opportunities and engagements we had as far as social action was providing manpower and service for our drive-through ministry, where in collaboration with the Rosemary Bryant, Second Harvest Food Bank, our church, individuals were able to come through and get food, which was a valuable need at that time and still is. And we were one of the early advocates of making sure that that particular project was in place during the pandemic, following all of the, I call them the protocols, and making sure that, again, needs were being met. And in working with the men of Kappa, and particularly our senior deacon at my church, Charles Bryant, who, again, if you see one, you're going to see the other. We were excited about just making sure that that happened. And not just with New Life, you know, we provided services with Reverend Miles when we could up at Bethune-Cookman, particularly when the kids were not in school, but it was just about providing services to individuals in need. So that's just one of the major projects that we committed to.
Ida Wright speaks on the AKA's support in the community with local residents of Daytona Beach.
Good afternoon. My name is Ida Wright, and I am the president of Alpha Kappa Alpha Sorority Incorporated Gamma Mu Omega chapter here in the great Daytona Beach, Florida. Our chapter has been in existence for approximately 80 years come December. And what did we do for COVID-19? COVID-19, our chapter displayed a billboard asking everyone to mask up. We also gave out car kits to our local communities doing a food drive. In addition to that, we made sure that we checked on one another. When COVID initially started, the first thing we did, we started a phone tree. So we checked in on our seniors within our chapter, then we checked on our members, and we made sure that all of them were safe and had the items that they needed. From there, we branched out to our community. We looked at the needs of our community, and again, that is how we created our car kits. Partnered with the items that was given to us from Volusia County, we took those items and added additional items, and then we distributed them during a food bank giveaway. Previously, we launched our Mask Up campaign, part of our international project. From there, we then met with some of our local doctors and physicians, as well as our healthcare workers, who was able to provide a Zoom meeting for the public to tell them some of the symptoms of COVID, what to do if they contracted COVID, how to take care of themselves during COVID. So we've had a series of workshops and Zoom meetings so that our public would know how to deal with COVID. We currently have members in our chapter that are physicians, that are in the medical field, who are often telling the members what to do with their family. Make sure the information is disseminated throughout our county and our city to make sure that everyone remains safe. Our biggest push now is not just vaccinations, but information. We know that there's a lot of hesitancy. We're in a county where there are 5 colleges and universities, and we will make sure that we share that with our visitors. How can they remain safe, what they can do. So through our Pandemic Win partnership, we're now going out to local businesses and looking at what do they have to protect the community, such as how many of them have outside seating. We have highlighted those businesses on Pandemic Win site, and as of today, we've had 1.2 million viewers. So when you visit our city and visit our county, you can know exactly where to go to eat, those restaurants that have outside eatery. So it is our goal, just like our founders, to make sure that when there's a crisis of any kind in our communities, that we inform our community and we inform the general public. And COVID-19 has given our organization an opportunity to inform, again, its members, the local communities, as well as anyone that really want to know what we are as an organization doing about COVID-19, keeping our members safe first, and then keeping our community safe second.
Daytona Beach businessman Pierre Louis speaks on conducting business during the COVID-19 pandemic.
All right, I'm here with Pierre Louis, a professional speaker. Also has his neighborhood networks, technology, business. Also, you was, during the time of the pandemic, you was director of the neighborhood networks.
That's correct.
Centers with the Daytona Beach Housing Authority.
We had actually closed. I had actually left them before that, but I was still associated with them, yeah. So I wasn't with them when actually COVID hit.
All right. So you've done a lot of work with kids and with seniors, like teach them technology and showing them technology and things of that sort. When the pandemic broke out, what kind of effects you seen it had on the seniors and the kids in our community?
Wow, it was tremendous because of the fact that it took remote training, remote learning, remote employment, and everything in the forefront. So when I saw it first hit, I thought to myself of how important closing that digital divide became very paramount. And in the areas that we lived in, because most of the time we had a number of people, our population, that didn't have computers at home. And if they did have computers at home, there was other reasons that came into play why they didn't have the internet. So because they had computers but didn't have connectivity, that's a totally different thing. So they didn't have that. So when the pandemic struck, and then a lot of people became more dependent on that, they didn't have the neighborhood network center to go to, then they were really at a loss. And then they first came out with the school board, they started giving out laptops, but then they also had to set up the broadband, and not only set up the broadband, but having the proper bandwidth. Because what I saw from, even though I wasn't at the centers anymore, but the kids in the neighborhood, because I live right in the neighborhood, I would ask the kids where they're studying or where they're going. Should I be talking to this camera? They're studying and going through the process of getting their homework done. But because the connectivity was so slow, the throughput and stuff like that, it was really hard. They get homework assignments, but it's buffering. And as you know, with kids' attention span, if it starts to buffer, they will end up going somewhere else and not actually staying with their homework or staying online. And that became a big problem. And then if you've got 4, 5, 6 children in the household or family members that are trying to get on the computer at the exact same time, or trying to get on the connectivity, that posed a really bad problem. So one of them, it's not like they're going to be scheduling it out where somebody has these amount of hours and somebody has to get on these amount of hours. It became a big issue. So a lot of times you'd have someone that could get some stuff done this day, somebody else had to transfer the next day. And then it posed a problem because what would happen when, because everybody was getting on, the bandwidth was all full, so to speak, you couldn't get on. Or people didn't have the proper devices that were, because some of the devices that they were giving out were outdated. And we weren't up to standards. We weren't really prepared for it. We weren't prepared for it remotely for what happened in our particular communities. For not only just the youth, but the community altogether, and definitely the senior citizens. Because the senior citizens were already going through a learning path or learning curve as it was, and they still needed assistance, not all seniors, but some of the seniors that were there, because I was teaching a seniors technology course, and some of them were just learning the new language of how to surf, how to get around on the internet. So when COVID hit, places that they would go to, such as neighborhood networks, were gone. And they didn't have computers at home, so things like putting in for their Medicare, putting in for their Medicaid, people putting in for their unemployment and stuff where they would go to neighborhood networks or they go to areas were gravely affected by that.
Volusia County Council Barbara Gertman addresses the residents of Volusia County on the part the county played in getting safety packages with hand sanitizer.
Blacks and browns were 2 times more likely to be impacted by the virus and 3 times more likely to die from it. So it's been a critical concern of mine. Also, from looking at the impact on Volusia County, our numbers throughout the county were reasonably high. So we put efforts in place to not only bring PPE into the community. I had more than 50,000 PPE packages delivered throughout Volusia County to schools, to businesses, to Black community. Made several deliveries to the Bethune Grill. So we know also to Bethune-Cookman College, because we know it's critical that everybody back up, wash up, and mask up, especially during the earlier periods of the pandemic. We were also responsible for bringing the state to Midtown for testing and surrounding areas when it was testing first came to our communities. And it was critical to ensure that blacks also, black and brown, also had that opportunity. Vaccines, critical. We brought, in coordination with the NAACP and the black clergy for Volusia County, East and West Side, we were able to get thousands of people vaccinated. We had events at Midtown, we had events in Spring Hill, and throughout black and brown communities, including the Hispanic area of within Daytona and Pearson. And yesterday, we acknowledged many of those volunteers. So we were pleased to see that. We also had a video of black leaders from Volusia County, East and West Side, to let the black community know, black and brown community know, how critical it is to be vaccinated, to get past this pandemic and get back to life as we know it. So again, it's been a critical concern of mine. Each of my family members were vaccinated. They each had told me that they were going to wait. However, I insisted. I planned and prepared, and they each received the vaccine. I received the Pfizer vaccine, several received the Moderna vaccine, and I even got my husband to get the Johnson & Johnson vaccine. So it is critical that we get our family vaccinated, our children vaccinated, and we get back to life as we know it, at least what our new normal may be going forward. So I'm grateful for this opportunity. I thank the community for all their support, but I let you know we are not 100% behind this. So we still need to take precaution. If you are not vaccinated, please continue to mask up. Please get vaccinated. Please consult your physician if you have concerns. And we are available if you need a way to get vaccinated.
Volusia County Sheriff Michael Chickwood addresses the Volusia County on crime during the pandemic.
I'm here with Volusia County Sheriff Michael Chitwood, and Sheriff Chitwood, the coronavirus pandemic hit 2020. What was it like from a law enforcement standpoint? Some of the things that you guys had to execute, especially during shutdown things and stuff like that.
Yeah, first and foremost was the health of everybody in the organization. You know, we have a 911 dispatch center. There's over 120 employees in there, and when people call for help, that has to be fully staffed. So one of the big things was to target hard in that place as best we could. Ultraviolet air filters were put into place, you know, social distancing masks. When the vaccine became available, we made sure that everybody out there could get it. We staggered shifts, we spread people out, and we were pretty successful the first round. The deputies, on the other hand, they have to be out on the street. They have to be, you know, dealing with people, touching people, arresting people. For the most part, they kind of really didn't do anything proactive per se. They didn't really go out and stop cars, for example. But they had masks, they had gloves, they had their PPE. And one of the things that I made sure that we did was every day we would load into our CAD system, computer-aided dispatch system, the Department of Health records of an address had COVID. And the reason for that was I wanted police, fire, and EMS to know if they were responding to 123 Main Street that home had tested positive for COVID, so they could take the proper precautions when they got there.
As for the precautions, was it like a scary thing for some of your deputies? Because, you know, a lot of you guys out there on the front line, you got to deal with these people. And plus, on the other hand, they can also get sick themselves.
I think that it was always in the back of everybody's mind when we were doing it. We did have 2 deputies that were really sick, that were hospitalized. But everybody else, including myself, that had it, thank God, even though I think I had a mildly severe case, if that's even a term. Most of us were either had very, very light or were moderate to severe. And then again, I had 2 deputies who were hospitalized. Unlike New York Police Department, NYPD, who lost dozens and dozens of officers were lost to COVID, and I think the number was probably over 150, 180 nationally. Officers lost their lives from COVID.
I mean, what effects did you see that COVID had on the population of the community? Because the sheriff, you have jurisdiction over everywhere. You're on the beach side, you're on mainland, you're in the African American community, over there in the Latino community. You're everywhere. You're west side of the county, east side. Just what are some of the challenges you've seen that the people had during the COVID?
Well, for the folks, one of the things we think was underreported was domestic violence, because you're not going to call the police during a pandemic to come and arrest your significant other for domestic violence, because they weren't taking anybody into jail. So you were kind of trapped inside the house. So I don't think, we had a true picture of what was going on with domestic violence. Property crime took a nosedive. There weren't too many burglaries because people were home. Right. There weren't too many stolen cars. There weren't too many larceny, car breaks. But violent crime, aggravated assaults, we saw a spike in that area, which was kind of an interesting thing to see.
Good morning, Mr. Chair. All right, can you tell us a little bit about yourself before we get started?
Yeah, my name is Charles W. Cherry II, born and raised here in Daytona Beach. I own an ad agency called 623 Management, which advertises and markets to the 17% of the population that's African American in the state of Florida, so that's about 3.1 million people. So we're in the ad agency business now.
Hey, tell us a little bit about what your company did during the coronavirus in the Black community. When
coronavirus first started, I had a local radio show called Free Your Mind, which was on the WELE, the CAT, and we were sponsored by the city of Daytona for about must have been about 13 weeks. So that was when the coronavirus pandemic first started, and on a regular basis, because we were on twice a week, we sort of tracked the virus to sort of give people an understanding of where it was, and had a couple of had Dr. Les Williams, who was affiliated with Halifax Health, on at least once a week to sort of give us some idea of how people should be handling themselves during the pandemic. Now this was actually prior to the wide distribution of the vaccine, so we've done that. That's one of the things we've done. Right now we're working with Florida Blue on a campaign to try to help Black folks to do two things. One, to be educated about the fact that there is high quality healthcare insurance that they can purchase for little or nothing. And two, to help them understand that the open enrollment of what used to be called Obamacare is going to start as of November 1st. So we know that Black Americans and Black Floridians are no different, are disproportionately uninsured. So we're trying to make sure that our community understands that you can get insurance, that you should get insurance, and that is readily available, particularly through a high quality insurance company like Florida Blue.
Okay, during the pandemic, you teamed up with Commissioner Juanita May.
Mm-hmm. Correct.
Can you tell us a little bit about that?
Yeah, she and I have been working sort of hand in hand on various projects. One of them, as I indicated, was just the educational process about the impact of the pandemic, and we specifically looked at how it was impacting the predominantly Black zip codes, including 32114 in Daytona Beach. One thing that we have to do specifically, Black folks are still lagging with regard to the percentage that has been completely vaccinated, and I think that people are telling me that that's starting to change, because now. We've always known from the beginning somebody in our community, somebody that's close to us, a family member, friend, or a friend of a friend that has been killed by coronavirus. We can go back to early in the coronavirus pandemic here, and of course we knew that Norma Bland, that everybody knew in this town, died of coronavirus, and then Harry Burney Jr. was one of the first victims of coronavirus up in New York, and those two deaths in and of themselves really shocked the community. And I think that it's taken a while, but I'm starting to see where, people talk about Tuskegee and the Tuskegee experiment, where the government essentially allowed Black men to maintain or to continue to be suffering from syphilis in order to see what the impact was on the human body. And people sort of get that sort of confused with and have a kind of bias against the government being involved in this. And I think slowly but surely, the fact that we know people who are unvaccinated and who have been very sick or have died is beginning to change minds, particularly as far as young people are concerned. Young people, I think, have a false sense of security, and I think we got to start talking more and more to our young folks to say, hey, look, sometimes they don't even know that they have underlying conditions, comorbidities, weight and other kinds of things that they suffer from that make them at risk of dying from the virus, and that was even before the Delta variant, and now we have another variant that's called the mu variant. So we've got to stay on top of our own folks in terms of education to try to get them to understand that this is a life and death decision that in some cases that you have to make.
Dr. Daniel Holler addresses the effects of mental health during and after the pandemic. My name is Diamond Davis. I'm a UCF film student, and I'm here with Dr. Holler at Bethune-Cookman University. I'll let you introduce yourself.
Hi, Diamond. Thank you. My name is Dr. Daniel Holler. I have a PhD in clinical psychology from Florida State University. Currently, I'm an assistant professor of psychology, and I serve as the department chair for the Department of Behavioral and Social Science Studies at Bethune-Cookman University.
Today, I'm going to ask you a few questions about the impact of COVID-19 on the African American community in Florida.
Sounds good.
Right. So, what have you found to be the most significant barrier to the African American community, minorities, and perhaps people in general?
Okay. Well, from just doing some of my own research on what are some barriers to getting this vaccine rolled out in certain populations, there are a myriad of reasons as to why people are hesitant about getting the vaccine. Everything from your political affiliation, so there's data that shows Republicans tend to be more resistant or hesitant to getting the vaccine, to racial and ethnic reasons or groups that are hesitant, in particular the African American community and the Hispanic community. So there have been, again, this is a complex issue, so there have been a lot of different reasons given and studied or explanations as to why, in particular, the Black community has been hesitant. So for example, initially when the vaccine was first rolled out, there were age limits. So you had to be 60 or 65 and older to get the vaccine. And so there was some research stating that that doesn't account for some of the life expectancy issues in the Black community, which Black people tend to die at a younger age due to chronic illnesses, things of that nature, than the white population. So maybe they should lower those rates. And then there's other research that was saying in the Hispanic community that may not necessarily have been an issue because Hispanics actually live longer than their white counterparts. So, they decided, well, in the Hispanic community, reducing the age limits wouldn't be a valid thing to do. There are other concerns such as the ability to access the vaccine, so getting to the locations where they're giving the vaccine could be hindered by lack of transportation, particularly in the Black community, not having access to a car or not having readily available public transportation that can take you to the locations and the sites. Those were some reasons given. But what I think at this point, because the numbers and the disparity between Black vaccination rates and whites has been closing, but there seems to be a halt recently in increasing those numbers. And what I think that has to do with is the long history of systemic racism in the country. In particular, we can talk about medical racism towards the Black community. We can talk about scientific racism. There is also the political climate as well. And so it's a complex issue. It's a psychological issue of trust. That's what I think is the main reason why a lot of people in the Black community are hesitant at this point.
Daytona Beach Commissioner Juanita May addresses the residents on tiny homes for the community after the pandemic.
How you doing, Commissioner May?
I am doing fine, thank you, sir.
Would you tell us a little bit about the events that will be coming up in 2021?
Sure. So an event that I'm especially proud of, it's called a tiny home, but I don't want to say tiny home. Let's call it a small footprint house. A small footprint home is something that has 1 bedroom, 1 bath, a living room, and a full kitchen area. It's an actual house. You can get a mortgage, you can get insurance for this particular thing, lay-it financing. It's about $80,000. I'm particularly proud of this particular concept because I'm bringing a tiny home to the Daytona Beach area, and it's going to be at Allen Chapel on November 4th. Of late, housing has become a bit of a crisis in Daytona Beach. We have many workers who need homes. We have families who need homes. We have people who are coming in. This common theme seems to be rent is too high. So my goal has always been for home ownership as opposed to renting a unit. To this end, I thought, why not bring a small unit and let people actually see what the commission oftentimes brings up in conversation. Oftentimes we discuss things, but we don't necessarily touch it, see it, or feel it. On November 4th, residents will be able to walk through a tiny home and also speak to a local developer. There are many, many builders of tiny homes. One happens to be coming, and they have graciously brought a unit along with them. It'll be available all day long for residents to take a look at. I want you to imagine this. You have a piece of land, don't know what to do with it. Why not put a small footprint home on it? It is a viable option for our affordable housing and workforce and student and single person housing situation.
Tell us a little bit about the food drives that you initiated.
Oh, sure. So during the pandemic in 2020, people were hungry, which at first I found hard to believe, but then I realized something. When we offer food to the community, when we give them food, it saves them resources, and the scarcity was in the resource. So we give you a package of food, it's one less thing that you're going to have to think about financially. And so many residents benefited from this, and we're still continuing the process. We're actually trying to figure out how to make the program a little bit more mobile.
Okay, is there anything else you'd like to add about the upcoming events for 2021 and bouncing back from the coronavirus?
The idea of bouncing back and recovery doesn't just relate to infrastructure or economics, it relates to people. And from that perspective, for me, I'm a registered marriage and family therapist. I work in health, fitness, and nutrition, as well as the mental health field. The bouncing back of the recovery process also has to do with the individual, with the person. I believe that many families are suffering right now, worried about the future, and many have taken a harsh economic setback. But we still have to have some sort of emotional stability to make decisions moving forward. So to that end, I intend to bring some emotional wellness, I'm more about enrichment, emotional wellness and some recovery into the Midtown area. And I will be doing some events at Bethune-Cookman University, and I'm hoping that the wellness of the students there will slowly migrate into the community and impact all of us.
Danny Fuqua speaks on teaching youth in Daytona how to become young pilots.
My name is Danny Fuqua. I'm the president for the Central Florida Black Pilots of America chapter, which is known by the Robert B. Griffin chapter for Central Florida. Today I'm preparing a lesson plan for our summer program for the youth here in Daytona Beach area. The first lesson plan will be takeoff and landings, because it is very important for them to have a good understanding on the takeoff procedures and the landing procedures. Our flight instructors are preparing for the students to come back. We haven't been doing a whole lot with the students during the pandemic. We're looking forward to this summer to resume our meetings, regular meetings with them. You know, it's important for us to reach out to the minority communities to introduce aviation to the kids. the kids in our community have been introduced to so many negative different things in life. If you turn on the news, you hear of a whole lot of bad things happening. But what we would like to do is to introduce aviation. It's to give them another avenue, another way of life to be successful and to work in the professional world in the general aviation. You know, a lot of people think when you think of aviation, they just think of a pilot. But we have the mechanics, we have flight attendants, we have aircraft maintenance. We also have in the general aviation, you know, ATC, air traffic control. And so that's what this program is all about, is to introduce aviation to our students. If you notice, we have the flight sim, and where that we will walk them through some step-by-step procedures before taking off, and after taking off is how to set the cruise control when you're up cruising at about 3,500 feet. We also walk them through landing, the proper way of landing. We also walk them through the various parts of the aircraft. We want them to be familiar with the Cessna 182, the Cessna 172, because the Cessna 172 is the training airplane. It's the training aircraft that all students will need to be familiar with, such as this model here. And if you notice, you know, we have a simulator of a runway. And what we do is walk them step by step before they go out to the actual airplane. As the president, my job is to make sure that we have certified flight instructors to be able to mentor. And what we do, we mentor the students so that they could be ready to go off to a aviation school to get their degree in aviation. Now, through this program, we do have a summer flight academy that's down in Houston, Texas. Our national BPA hosts each year. And I would encourage different parents, if they have a child who have an interest in aviation, is to contact me. You can contact me by going to our Facebook page. You could inbox me, or you could also go to the web page, Robert B. Griffin Chapter, BPA, or just type in BPA, Black Pilots of America, and contact us. We would like to hear from you. Also, as the president, we also want to make sure that during the school year, we go into the schools and just introduce aviation to our youth, to give them an opportunity to become a member of our local Black Pilots of America chapter here in Daytona Beach. Thank you.
Ethan Johnson is the Volusia County Health Department Communications and Performance Director. He speaks on behalf of the Health Department.
Good morning, Mr. Johnson.
Good morning. My name's Ethan Johnson. I work for the Florida Department of Health in Volusia County. Here I am the Assistant County Health Department Director, and I oversee most of our community service programs, as well as functioning as the Public Information Officer. In terms of COVID-19, over the past few months, we've seen the highest spike in numbers, cases, and deaths, hospitalizations that we've seen throughout the pandemic. Here in Volusia County, back toward the end of July and the first week of August, we had a transmission rate of 589 cases per 100,000 people. And to put that into context, what's considered to be high is 100 cases per 100,000 people. So we were almost 6 times beyond what that threshold is. Presently, we've gotten down to below 300. So we're trending in the right direction, but a lot of work still needs to happen. And given that we're over that 100 threshold, that lets you know that the virus is still very prevalent within our community. In terms of what the Department of Health in Volusia County is doing, We're involved in many different outreach events, but specifically in communities that are still vocalizing some hesitancy toward the vaccine. We know that before COVID-19, there were many disenfranchised communities, specifically African American and Spanish speaking communities, that had limited access to health resources. And this had nothing to do with the pandemic. And on top of limited access to resources, there was a legacy, and still is a legacy, of distrust for healthcare and the government between African American communities and the government healthcare system. So we know that COVID-19 has exacerbated that issue quite a bit. What we've done at the health department is that we've kind of opened our doors, as well as reached out to as many community partners as possible and letting them know, one, of course, we're willing and available to come and do vaccines as well as testing for individuals, communities, churches, but we're also willing to come and just provide some education. We have a really great outreach team, and we've partnered with Bethune-Cookman University to really be able to go into the community and have some conversations with people around the vaccine itself. A lot of people have questions that that haven't been adequately answered, and if they are answered and people's concerns are addressed, a lot of people do decide that they are willing to take the vaccine. And we know that although vaccination isn't the only opportunity we have to fight the virus, it is the number one. So on top of vaccination, of course, we want to make sure that we're continuing to practice other mitigation strategies such as hand washing, mask wearing, avoiding large crowds. And I will say that it's tempting because, as I mentioned earlier, as the numbers trend down, it's tempting to go back to life as normal. But what we do know is that the virus is still out there, and you're going to come in contact with it in the community. And we know that although you're vaccinated and that provides a layer of protection, it's still possible for you to be infected. So we want to keep being safe and keep practicing multiple mitigation strategies, especially in communities of color, because we are at an increased risk. And that is really our ticket out of this.
Living in this world today is a battle in some way for everyone, but is especially challenging for our youth. They easily get discouraged and find themselves trapped in a cycle. The challenges of early adolescence are intensified for youths who live in disadvantaged urban communities. An atmosphere often characterized by poverty, violence, crime, substance abuse, stressful family life, and few positive adult role models, cornered by obstacles, powerless to resist, and destined to fail. Sozo Missions endeavors to break the cycle and bring hope to this generation and the next. Not only does Sozo offer faith-based youth clubs on a weekly basis in the Samoset community, our mission is large and our territories are international. Every week, our Sozo Juvenile Detention Mission goes into the Manatee Regional Juvenile Detention Center to offer chapel services, small group Bible studies, and one-on-one counseling to detained youth. Our goal is to empower teens to rise up above their current situation by starting a new life in Christ. Sozo goes out to local high schools providing weekly mentoring and uplifting pep rallies. We challenge students to break the cycle of repeated destructive choices and life patterns, sharing with them the importance of respecting authority, staying in school, and making right choices. Our camps provide a setting in which youth are removed from the fast pace of our culture to focus on the Bible, prayer, worship, and fellowship for spiritual growth. For the second year in a row, Sozo was blessed with the opportunity to join the Hearts of Fire missions team in Kenya, Africa. We played games with the Kenyan youth, shared the story of creation, learned and sang Kenyan praise songs, provided the children with fresh, clean bottled water to drink and snacks, but most importantly, we fed them the bread of life, the gospel. At Sozo Missions, many of our young people receive Christ for the very first time, and this gives them hope and strength to deal with the many temptations they face every single day. Our mission is to passionately share the love of Christ with hope to transform the lives of urban youth, their families, and the communities in which they live. Sozo Missions, transforming lives.
I got the shot. I got the shot. Oh yeah. Go get the shot. Go get it. Go get the shot. Go get it. I got the shot. I have to get my COVID vaccine. Protecting all my friends and family. I got the shot. I got the shot. Oh yeah. Go get the shot. Go get it. Go get the shot. Go get it. I got the shot. I have to get my COVID vaccine. I ain't trying to die from that disease.
No sir, not me. Corona is spreading again. Killing my family and friends. Deadly, just like a sin. We got to bring this virus to an end. I got the shot. I got the shot. I got it quick. I got it quick. Go get the shot. Go get the shot so you don't get sick. So you don't get sick. I'm looking out for your life. You matter. You should be doing the same. You shouldn't believe all that hype. Cause COVID ain't playing no games. The enemy sent the disease. But you wanna blame the Chinese. Rafa sent the vaccine. Go get the shot. I'm begging you, please. I'm begging you. You say you walking in faith. Without no mask on your face. What's up? Why don't you try to be safe? Unvaccinated, yo, what a disgrace. Corona is spreading again. Killing my family and friends. Deadly, just like a sin. We got to bring this virus to an end.
I got the shot. Oh yeah. Go get the shot. Go get it. Go get the shot. Go get it. I got the shot. I have to get my COVID vaccine. Protecting all my friends and family. I got the shot. I got the shot. Oh yeah.